It's time again for Health Monitor, the #1 program that's shows you how to live a life in its healthiest way. To improve the quality of health of life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah.
Good to be back again. This is your favorite health program, Health Monitor, your guide to good health. I am Ajenike Famujuro Fakayode. On today's program, we have the health tips segment, assisted conception and body care. Today's episode is fully loaded because I have a specialist in the studio that will be talking to us about something very, very important. We'll be right back.
Hand washing health tips. Your hands are very vital to preventing the spread of diseases and infections. Wash your hands under running water for up to 20 seconds with antibacterial medicated soap. This health tip is from Health Monitor, your guide to good health, and sponsored by Mediclam Antibacterial Medicated Soap from the stable of Darago Industries Limited.
On Health Tips today, we are bringing to you the different ways that your body can fight coronavirus. So to boost your immunity against coronavirus, there are certain lines of defense that your body has to fight the virus. One of such defense is the tissue marophagus. The tissue marophagus is a mechanism that your body has to prevent you from going down with coronavirus. And for that defense to be effective, you need to have rest. So that means you need to sleep at least 8 hours per night. Okay, for your tissue marophagus to be effective as well, you need to drink warm liquids. Warm liquids like warm water. And then you need to supplement your zinc. You know, zinc doesn't come alone. It comes mixed together with other vitamins. So the zinc in the vitamin you're taking should be at least between 50 and 100 milligrams per day. Another defense mechanism that the body has against coronavirus is the neutrophil invasion. This invasion is very effective against coronavirus in your body if you can avoid sugars. Okay, then you take a lot of vitamin C. The recommended milligrams per day is 3,000 for vitamin C. Okay, and you know, vitamin C, you can find vitamin C also in lemons and oranges. Then another line of defense is the monocyte invasion. For your monocyte invasion to be effective against the coronavirus, you need vitamin D. And you know, vitamin D can be gotten in supplements because you don't have enough foods containing vitamin D. But you have the sun. So the early morning and the late evening sun can give you vitamin D. You can also find vitamin D in fish, such as salmon and sardines. Not forgetting to take the general precautions against the virus from getting into your body. One of such precautions is to wash your hands regularly and use sanitizers. Then you cover your nose or your mouth when you sneeze, in case you sneeze, okay? Then you avoid close contact. Then you cook meats and eggs. Cook your egg well and cook your meat well before you eat them. Then you avoid wild animals.
It's Health Monitor, the #1 health show.
Since there are two tubes, if a woman has one of the tubes blocked, then there's a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
My name is Dr. Olushola Akini, the medical director of True Care Fertility Clinic, Victoria Island, Lagos. I'm a gynecologist and a fertility expert. We're going to talk about the age of a woman in relationship to success rate in IVF. Every month, many eggs are recruited from either or both, usually from one of the ovaries. And within days, one egg out of the lot overrides the chemical environment of the other eggs and becomes the leading egg. It is this leading egg that eventually is ovulated. Like I said, if we assume that a woman starts her childbearing period at about the age of 18 when she's mature, until say about 45 years, then such a woman will need about 400 eggs if she were to be ovulating or using the egg one per month. Now, recount that I said that typically they have 400,000, which means that nature has given them more than enough. But the issue is that with each cycle, they recruit more than what is needed, and the rest are wasted. And it is this reason why this is the reason why there is what we call age-related decline. That is, as a woman grows older, the number of eggs left becomes smaller, and because of the chronological age, the egg is as old as the woman. And in biology, we all know that teenagers are better athletes than older women. So also for eggs, young eggs, that is, when I say young, I mean eggs from teenagers and young women are more versatile than eggs from older women. This means that at a point, therefore, the eggs becomes too old in terms of reproductive capacity. And we say in gynecology that when a woman attains 35 years and beyond, we refer to such women as old, especially if they are about to start making their families. That is, they have not had children up to 35 years. Why the age of 35? The age of 35 years is a consensus age for women because this is the age at which, if the graph of age and congenital anomalies were to be drawn, it will intersect at about the age of 35, which means that at about the age of 35 and beyond, many problems begin to show up if a woman is still making families. The eggs are 35 years old. There are some congenital anomalies that begins to increase in terms of frequencies. That is, the woman stands higher risk of giving birth to babies with congenital defects. So the age of 35 years is a consensus cutoff age. And we encourage or advise that women should start their families earlier. Now, I have just said that women recruit eggs every cycle. And let us say that hypothetically a woman recruits about maybe 10 eggs to 15 eggs, and only one develops. It then means that 9 to 14 eggs have been wasted. And this is the way eggs are being wasted when a woman is still in the reproductive age bracket. It then means that as the woman ages or gets older, the number of eggs available, reproductive functions or capabilities is much less. We call this ovarian reserve. In other words, the ovarian reserve is much less. Ovarian reserve refers to the amount of high-quality eggs left in the ovaries for the purpose that the woman can use for the purpose of childbearing. Another issue is that by nature, the woman tends to, or women tend to recruit the best of the eggs they have in reserve. I think this is logical. So what is then left will be the number of eggs that are perhaps not too good because they must have been selected out and are left behind. These eggs are more likely to be those that have some genetic defects. We all know that with age, the frequency of genetic problems increase. So we also like to, point out that in the dynamics of infertility, like I said, women should therefore be at the driver's seat. A man, unlike the woman, men produce sperm cells almost at a dynamic rate. And that is supposed to be throughout life, as long as the man is still alive. The number and quality may decline, but then it is not as severe as what we have in women. So our women should know that it is not in their benefit to hold back or to tarry. Once you have infertility challenge and you've visited doctors at the primary and maybe secondary level, and you are not getting results, I think it may be wise to visit centers like True Care Fertility, where there is expertise and capability to look closely into the problem and help you out. Since there are two tubes, if a woman has one of the tubes blocked, then there is a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
Hand washing health tips. Your hands are very vital to preventing the spread of diseases and infections. Wash your hands under running water for up to 20 seconds with antibacterial medicated soap. This health tip is from Health Monitor, your guide to good health, and sponsored by Mediclam Antibacterial Medicated Soap from the stable of Darago Industries Limited.
Before we went on the short break, I told you I have a specialist in the studio. She's Dr. Jane Atebo. She's a dentist, and she'll be talking to us about something very, very important, our oral hygiene, and so many things you need to know about oral hygiene. Dr. Jane, you're welcome to Health Monitor, your guide to good health.
Thank you for having me.
You're welcome.
Thank you.
Yeah. To start with, how do you maintain your oral hygiene? You know, being a specialist, how do you maintain your oral hygiene? Okay. To start with you.
Okay, first, one, I brush twice in a day, which is very important. And I use a toothpaste that contains fluoride. And I also use a medium toothbrush. I don't use hard toothbrush because hard toothbrush tend to weaken your gum. And your gums will recede, and then plaque, calculus, they will accumulate on you, on the gum, which is not too good for our oral health.
That's very good. Now, to our viewers at home, how do you briefly just tell us to practice good oral hygiene.
Okay. When we say oral hygiene, the way we take care of something so that it will not be dirty, to be clean. So oral hygiene is talking about the practice of keeping our mouth clean so that we'll prevent gum disease and also tooth decay.
What and what?
Like I said during my intro.
Okay.
For you to maintain an oral hygiene, first of all, like I said, you must always brush morning and at night, at least twice in a day.
Not after each meal?
No, not after each meal. At least morning and night. Even to even get some people to even do twice a day, at least brush in the morning, at least once a day.
Once a day.
Yeah. Then ideally too, you are supposed to floss in between your teeth to remove dirt too.
After meal?
After meal. Yes, because food tends to pack in between your teeth, especially those that has loose teeth. Some people have tightly packed teeth, but it's always ideal for you to use your dental floss, not toothpick, because toothpick tends to injure the gum and also create space in between two teeth. So it is ideal for you to use your dental floss so that all this dirt will not stay between food will not pack in between your teeth. And also, it's also advisable to see your dentist too, at least twice in a year. So if there is any case of any tooth decay, the solution will be remedied immediately.
Okay.
Yes.
During your introduction, you mentioned fluoride.
Yes.
How important? So, are you saying that if you're using any toothpaste, it has to contain fluoride?
Yes, because fluoride tends to reduce tooth decay. And it also, like I said, there are 3 layers on the structure of the teeth. You have the outer layer, which is the enamel, the middle layer, which is the dentine, and the innermost layer, which is the pulp. So that enamel is the hardest substance known, is the protective part of the tooth. So that the fluoride helps to reduce the rate at which plaque will penetrate inside the enamel. So it helps to remineralize the tooth too, and it prevents the tooth from decay.
Like you said earlier, you mentioned that you go against hard brush.
Yes.
But what about smokers that they use hard?
It's not, like I said, it's not good to use hard toothbrush, because if you use hard toothbrush, you tend to wear away the protective part of the tooth, which is the enamel, and the tooth will now be prone to sensitivity. That the dentine will be exposed, and also, it will also destroy the gums. The gums will recede, and this will also promote plaque and calculus buildup.
The recede you're talking about is
the gums will wear out. They will wear out. Like the thing will just wash. They will wear out. Wash it.
They won't be strong again.
No, you will. It will be like the gums will be cutting. Let me use that word. It will be cutting. You will not see the gum. The thing will just be. It will be dropping.
Okay, dropping.
The height
slightly.
of the gum will be reducing.
Oh, okay, will be reducing. Okay. I know.
Yes.
Okay,
Yes.
Then children with milk teeth, and I know there are some adults that still have their milk teeth. Is that normal?
Yeah, like I always say to my patients, different individual, different genetic makeup. Some people are early. Some people they tend to their teeth eruption tend to occur easily early in some group of individuals. Some children, some they are late erupters. There are some people they shed their milk teeth very early. Some people they even take it till up to adult life.
Yeah, adults.
Some people don't even want to remove it, but when some of them come present, and if it's posing threat to their oral health, they don't have a choice than to remove it.
So tell us, doctor, what causes mouth odor?
Yes.
And how do we prevent that?
Medically,
Bad breath?
Yes, we call it halitosis, bad breath.
Is it genetic?
It's not genetic. It's not genetic. It's not genetic.
It's not hereditary.
It's not hereditary. It's not hereditary. Like I always say, in this part of the world, dental awareness is quite poor. Halitosis, like I said, is bad breath, and it's due to a lot of causes. One, if you don't maintain a good oral hygiene, I said always try and brush. If at all you can't brush twice in a day, try and always brush in the morning. But most people, maybe because of their lifestyle, they don't brush at all. And this will cause plaque and calculus accumulation. And all these are aggregates of bacteria. It will make the mouth smell. It will bind to the tooth. It will bind to the gum. the gums will become swollen, and it will even eat part of the gum too. All these things, and it also creates what we call a periodontal pocket around the gum. There is a space, so all those spaces there, it will eat the gum, it will eat the bone, food will start packing around there, and if it's not checked.
What about the tongue?
The tongue, I'll come. If all this process is not checked, it will make the mouth to smell. If you don't brush your tongue too, especially we call it the dorsum of the tongue. If you don't brush it properly too, it will make your mouth to smell. And also lifestyle, people, chronic alcoholics, people that smoke, it will also make your mouth to smell. Some medical conditions, like I mentioned, like some people, yes, some medical conditions, like people with uncontrolled diabetes, you can even diagnose it orally when you see, when the patient opens, you can like, this patient, I'm sure is a diabetic patient, because most of them are slow to heal. So, and if they not have poor hygiene again, it's not too good. Their breath will smell. Then people with liver or kidney issues too, they will have bad breath too. Even people with upper respiratory tract infection, people with sinusitis, or people with tonsillitis too, especially if it's swollen, a lot of them will smell.
Tonsillitis you're talking about is the swelling of the tongue.
No, tonsillitis is the swelling of the tonsils. They are located at the back of the throat, like they are oval shaped, two shaped. When you say you say they are at the back.
Okay.
So most times it's always symptomatic. Sometimes it's for some group of individuals. Then you talked about medications. Yes, there are some medications how they can lead to bad breath. Most of this medication, they can affect the salivary gland. So if they affect salivary gland, saliva will not be produced that much. It will make the mouth dry. And once it makes the mouth dry, when you eat, if at all you drink water, all the dirt, all the other food debris that remains in your mouth, it cannot be washed away. So if the saliva is not there, the food is also packed there, and it will decay. Bacteria will act on them. It will make your mouth to smell.
So, what are the side effects of scaling and polishing?
Okay.
Polishing of teeth.
Scaling and polishing. Hardly is there any side effect. If at all, it's minimal and it's always ignored. It's only few people that say, okay, my teeth is sensitive, but all is in a bit to help you maintain a good oral hygiene.
So please tell us about filling of teeth and implant.
Filling of teeth is different. Dental implant is another way entirely. Filling of teeth, a patient presents to you, I have it's like I have a hole in my mouth. I don't know, sometimes it's sensitive, but for you to diagnose if you want to go ahead with your filling, you have to take an x-ray, like I said. So if the insult has not gotten to the danger zone, which is the pulp, you can go ahead to fill. That's when filling comes into play. But dental implant is a different thing entirely. Maybe the patient has lost the tooth due to a grossly carious tooth or decayed tooth. Let me put it out so that the viewers will understand. A grossly carious, maybe, and you just have to remove the tooth. So some people don't like just to leave that space and let it just be like that. Say, okay, please, can I do something? Those ones that maybe they don't. There are some people that you have other alternatives, as you have your dentures, removable denture. But most people, they are not comfortable using dentures. They say they don't want to be removing and bringing out. They want something permanent. So the implant is the permanent one. So you suggest it to them. You tell them the procedure. So the implant is screwed inside the bone. Okay. Yes, it's screwed inside the bone, and it's not like
inside the bone with the gum.
No, not with the gum. It's a surgical procedure. It's a process. It's a process. It's a surgical procedure.
Okay.
Yes, and before you do all these things, your patient has to be motivated. You have to assess your patient. Is it this kind of person that will be able to manage the denture? And you don't have to look at the person's oral health too. If it's someone that cannot manage his oral health, I don't know if this implant is going to work.
It's going to work or not. Okay, how do we prevent tooth decay?
Okay, better. Like, first of all, always visit your dentist twice a year. Brush morning and at night, and use a fluoride containing toothpaste, and also try and change your toothbrush at least after 3 months. You know, some people the toothbrush is arranged in bristles is arranged in bundles. Yeah. So when the bristles when they start flaring apart, it's not too good. It's not too good. So for your own good. It's always good to change at least every 3 months.
Then after brushing, is it necessary for us to use mouthwash? Mouthwash? Not necessarily.
So I don't belong to that school of thoughts that you must always use your mouthwash.
Yeah, there's this thing that comes after brushing. There's this white substance. Can I call it substance?
It's a they call it a biofilm. It's normal. When you brush, you always see it.
Because some people are so concerned about it.
Yes, it's not. It's not.
Okay. Thank you, doctor, for the session we had with you. We really appreciate it, and I hope next time we'll call on you. Thank you very much. Really appreciate it.
It's Health Monitor, the #1 health show. It's time again for Health Monitor.
It is time for Health Monitor once again. My name is Jibe Ologe.
Today I'm going to be talking about menopause. Medically, it's defined as 1 year of no menstrual flow in a woman.
When we put the two side by side, the one that I use microwave on, it's like rubber.
Okay, so basically what health insurance does is to prepare you against any unforeseen medical emergencies or medical events.
Vegetable milk.
I'm talking about milk like soy milk, provided that soy is produced here. Because most of the soy produced in the US or Europe is GMO soy.
For advert placement, contact R. Wells Media and Advertising Company Limited. Telephone.
Thank you for joining us today on Health Monitor, your guide to good health. And I hope you have learned one or two things about today's program. Till I come your way next time, I am Decay Famujuro Fakayode. Be healthy and stay healthy. Bye-bye.